There is an epidemic out there. Deaths from fentanyl. We are seeing it across our viewing area, and indeed we're seeing it across the country. Evita Morin is the CEO from Recovery. She joins us for this Q&A. Evita, always a pleasure to see you. When we talk about fentanyl, obviously it's a scary word, but I'm not sure people really understand what it is, how prevalent it is. So let's start there. Are we seeing fentanyl in San Antonio, in both the big city of San Antonio as well as some of the smaller areas around our city?
Yes, I think people with loved ones who are using drugs recreationally need to be aware that it is everywhere. Just from 2018 to 2020, there was a 40% increase in overdose emergency calls in Bexar County. So that is just our community, a 40% increase. So we anticipate 2021 and 2022 to have increased even further than that.
And so how are people getting this? Because it's my understanding that people don't go out seeking fentanyl, right? They're going out looking for something else, but then how are they coming into contact with it?
It's really devastating because a lot of these kids, frankly, a lot of kids are using these drugs recreationally. They're using things like, or thinking they're using things like oxycodone and other types of recreational drugs that are used to not cause death. They may have caused addiction at a time, but now they are manufactured in Mexico, in China. They're manufactured to look exactly like these drugs that they're not, and they're laced with fentanyl because it is so much more potent that you can transport more of it to our country. So that is why fentanyl has become such a rash in our community, and why you need to be so careful anytime you decide to put something, a drug in your mouth that you don't know where it came from.
Yeah, I think we saw some kids in Hayes County thought they were getting Percocet, and it was laced with fentanyl. Why, and you kind of answered this question, but I want to be more direct about it. Why is fentanyl used in some of these things? Does it give you more of a, for lack of a better word, more of a kick, more of a high than just the normal drug would do?
That's, it is less about the high, why fentanyl is laced in these things, and so much more about the economics. It is because it is so much stronger than any other opiate on the market. We're talking 50 to 100 times stronger than heroin and morphine. Then drug dealers, drug cartels can move more of it than you could, say, heroin or fake Percocets. So it's being moved and drawn into these other drugs, thinking these individuals that are doing this are not, they're lacing it because they think it'll spread more, they'll be able to spread more drugs across the community. And that's really the devastating part of this, is that there aren't a lot of people looking for fentanyl and looking to abuse fentanyl, especially because it's manufactured illegally now. They're finding it in things that they thought were safer, and they don't have the kind of life-saving measures around, and so they end up overdosing.
We mentioned the deaths among students in Hayes County, and we're showing some of the images of these drugs. And some of these pills, some of these substances, they're very colorful. They look like candy. I mean, you could see why this could be appealing to kids. Is that really where we're seeing this spread among teenagers?
We're seeing it everywhere. I think the concern I have as a mother, looking at a bag of this multicolored candy-looking drug, is that it's going to reach hands that have no idea. Small children that think you've got candy lying around and put it in their mouth and not realize that they've just ingested a deadly poison. So that is my big concern: is the accidental overdoses that are going to take part as a part of that horrible rainbow fentanyl that we're seeing. But I think for teenagers, it is so much more about mental health. It is so much more about so many other reasons that they are struggling and using as a method to try and get through stress and through life, hard times. So they're trying to get high. They're not trying to kill themselves, but they are finding things like Percocet, like oxycodone. They're not likely to try. I doubt that any of those kids in Hayes County shot up heroin. It's much more likely that they tried something they thought was safer.
Talk about how you can protect, as a parent, your advice for protecting against fentanyl, for a parent and for the kids that are out there, because I know you have children, and some of this stuff looks like Flintstone chewables. I mean,
exactly.
How do you protect our families against fentanyl?
I think one of the most important things every family should have in their medicine cabinet is Narcan, and that is available through morenarcanplease.com. It is free to people in Bexar County, and I recommend learning more about Narcan because it is an opioid reversal drug. It essentially stops that overdose. It's like an antidote to that overdose that's happening, and it is becoming more and more accessible to the common person. And so I would have Narcan in every single medicine cabinet in the event that, God forbid, something like that happened to your young adult, your teenager. And I think also talking about drug use. It is not going to increase risk if you talk about it and you have maybe substance use in your past. It's going to inform really important facts about your background that your child needs to know. It's very important that we not be afraid and we not stigmatize the conversation, and that we are letting kids know that this fentanyl could be in anything and that the risk is too great to not have that conversation with your parents.
Yeah, open a line of communications.
Mm-hmm. Yeah. And Evita, before we let you go, I want to ask you a question that's may have a very simple answer. Is there any way to look at a drug and tell whether it is laced with fentanyl?
There is no way to do that. And it is the amount of a size of a couple grains of salt can be an overdose for someone. It is so small, and it looks like a white powder, much like a lot of other drugs do. I would definitely recommend that if anyone is struggling to consider that there is a Bexar County helpline, 210-SAY-CARE. That's 210-729-2273. And that is available to all Bexar County residents to get the resources that they need to connect to find the support that they need.
210-SAY, S-A-Y, CARE, C-A-R-E. Evita Morin, CEO of Rise Recovery. Always appreciate your time. Thank you.